DV 4. Question 1. Which individual is at the highest risk for developing hypertension? 45-year-old African-American attorney with a sedentary lifestyle and high-sodium diet. 60-year-old Asian-American shop owner with BMI of 28 and managed diabetes. 40-year-old Caucasian nurse with high stress but healthy BMI and vegetarian diet. 55-year-old Hispanic teacher who smokes occasionally but exercises. African-American adults have a higher prevalence of hypertension. Combined with family history, sedentary lifestyle, and high sodium, this individual has the highest risk profile. Question 2. A 15-year-old ingested 15 maximum strength acetaminophen tablets 45 minutes ago. Which order should the nurse prioritize? Perform gastric lavage. Administer acetylcysteine, mucomist, orally. Start in 4 with dextrose 5% and 0.33% normal saline. Have the patient drink activated charcoal mixed with water. Acetylcysteine is the specific antidote for acetaminophen toxicity and should be administered as soon as possible to prevent irreversible liver damage. Question 3. Which complication should a nurse monitor closely in the initial 24 hours after a cardiac catheterization? Persistent angina despite rest, thrombus formation, sudden drop in blood pressure when standing, gradual decrease in blood pressure with no other symptoms. Thrombus formation at the insertion site is a critical complication that can lead to decreased limb perfusion or systemic embolization. Question 4. What is the top priority nursing goal for a client with recurrent renal calculi presenting with severe flank pain and nausea? Maintain fluid and electrolyte balance, control nausea, manage pain, prevent urinary tract infection. Pain management is the priority in renal colic. Relief is typically achieved through parenteral narcotics or NSAIDs to improve the patient's quality of life and stability. Question 5. In a school screening for children aged 6 to 12, what growth parameter is typical for this age group? Decreasing amounts of body fat and muscle mass. Little change in body appearance from year to year. Progressive height increase of 4 inches each year. Yearly weight gain of about 5.5 pounds per year. School-age children typically gain about 5.5 pounds per year and grow approximately 2 inches in height annually. Question 6. A client's BP is 160/96 mmHg at a health fair. The client says it is usually lower. What is the best advice? Recheck blood pressure within the next 15 minutes. Check blood pressure again in 2 months. See the healthcare provider immediately. Visit the healthcare provider within 1 week. The reading is moderately high. Rechecking after a short rest verifies the reading and determines if immediate intervention for potential hypertensive crisis is needed. Question 7. During a disaster drill, which client should be considered first for discharge to make room for casualties? Middle-aged client with chronic ventilator dependence admitted for pneumonia 5 days ago. Young adult with type 2 diabetes admitted for antibiotic-induced diarrhea 24 hours ago. Elderly client with Stevens-Johnson syndrome admitted that morning. Adolescent with HIV admitted for acute cellulitis 48 hours ago. Clients with chronic conditions who are stable and familiar with their own complex care, like long-term vent users, are often the safest candidates for early discharge during a crisis. Question 8. A client is prescribed levothyroxine, Synthroid, 50 mcg/day. Which point should the nurse emphasize? Should be taken in the morning. May decrease the client's energy level. Must be stored in a transparent container. Will decrease the client's heart rate. Levothyroxine can cause insomnia if taken late in the day. Taking it in the morning mimics the body's natural rhythm and avoids sleep interference. Question 9. A 3-year-old presents with irritability, muffled voice, drooling, and sitting forward with tongue protruding. What is the nurse's first action? Prepare the child for X-ray of upper airways. Examine the child's throat. Collect a sputum specimen. Notify the healthcare provider of the child's status. These are classic signs of epiglottitis, a medical emergency. The provider must be notified immediately. Throat examination is contraindicated as it can cause total airway obstruction. Question 10. Which symptom of diabetes is most likely to prompt parents to seek medical evaluation for a school-aged child? Polyphagia, dehydration, bedwetting, weight loss. Bedwetting, secondary enuresis, in a previously continent child is a major red flag for parents and often the primary reason they seek medical help for undiagnosed diabetes. Question 11. Which infection is most frequently associated with a recurrence of pelvic inflammatory disease, PID? Trichomoniasis, chlamydia, staphylococcus, streptococcus. Chlamydia and gonorrhea are the most common causes of PID. Chlamydia is frequently associated with recurrence and can lead to long-term complications like infertility. Question 12. A nurse specialized in spinal rehab is floated to the ED. Which patient is most appropriate for this nurse? Client who took too many diet pills with a racing heart. Patient experiencing alcohol withdrawal with jerking limbs. Adolescent with terminal cancer, pinpoint pupils, and RR of 11. Elderly client who recently used crack cocaine. Float nurses should be assigned the most stable patients with predictable outcomes. The oncology patient has expected side effects of opioid therapy and the lowest immediate risk. Question 13. Which dietary advice should the nurse prioritize for a client with coronary artery disease? Eating 3 balanced meals a day, adding complex carbohydrates, avoiding very heavy meals, limiting sodium to 7 gms per day. Heavy meals divert blood to the GI tract for digestion, which can strain a heart already compromised by coronary artery disease. Question 14. A patient on a morphine PCA pump, 10 ml per hour basal, had 100 ml at 0800 and 80 ml at 1200. Why is this a concern? The patient has slight redness at the fore site. The patient says they have no relief. The pump is not delivering the correct basal rate. The patient's RR is 8 breaths per minute. At 10 ml per hour, 40 ml should have been delivered over 4 hours. If 100 ml was the start, 60 ml should remain. 80 ml remaining indicates the pump is malfunctioning or the line is occluded. Question 15. What is the primary focus of chiropractic treatment for an elderly patient with chronic back pain? Electrical energy fields, spinal column manipulation, mind-body balance, joint exercise. Chiropractic medicine focuses on the musculoskeletal system, particularly the spine, through manual manipulation to improve function and relieve pain. Question 16. Following a right-sided CVA, which finding requires immediate intervention? Decrease in the level of consciousness, loss of bladder control, altered sensation in the fingers, emotional lability. A declining level of consciousness is the most sensitive indicator of neurological deterioration and increasing intracranial pressure. Question 17. Which later-stage symptom of cystic fibrosis would a nurse not expect to see in a newly diagnosed 6-year-old? Positive sweat test, bulky greasy stools, moist, productive cough, meconium ileus. A moist, productive cough typically develops as the disease progresses and lung damage accumulates. Sweat tests and stool changes are often seen much earlier. Question 18. A client is confused and lethargic 2 hours after a fall. What should the nurse do? Select all that apply. Arrange immediate transport to ER. Assess for pupil dilation and irregular breathing. Keep the client in a calm, quiet environment. All of the above. Lethargy and confusion after head trauma suggest intracranial bleeding. Immediate ER evaluation, neuroassessment, and minimizing stimulation are vital. Question 19. What preparation is needed for a cub, kidney, ureter, bladder, radiograph? NPO for 6 hours. Enema the evening before. Administer 4 furosemide. No special preparation is usually needed. A cub is a standard X-ray. It generally requires no special prep, though having the patient void before the test can improve image clarity of the pelvic area. Question 20. When is it generally safe for a client to resume sexual activity after a myocardial infarction? After 1 week of bed rest. When they can climb 2 flights of stairs without symptoms. Only after a stress test is passed. After the first follow-up appointment. Being able to climb 2 flights of stairs or walk briskly without shortness of breath or chest pain is a standard physical benchmark for resuming sexual activity. Question 21. Which client should a triage nurse see first in a crowded ER? 2-month-old with bulging fontanelle, teenager with a singed beard from a campfire, elderly client with liquid brown stools, middle-aged client with scapular pain. A singed beard suggests inhalation injury and potential for rapid airway edema. This is a life-threatening priority over the other stable or non-respiratory cases. Question 22. A mother of a 2-year-old says, "I understand the need to use those new skills." This indicates an understanding of which developmental stage: trust versus mistrust, autonomy versus shame and doubt, initiative versus guilt, industry versus inferiority. Toddlers, 1 to 3 years, are in the stage of autonomy versus shame and doubt, where they must explore and use motor skills to develop independence. Question 23. What is the most important action before administering a nasogastric (ING) tube feeding? Check the feeding solution temperature. Check for residual volume. Verify correct placement of the tube. Clean the insertion site. Verifying placement via pH testing or X-ray is the most critical step to prevent aspiration of the feeding into the lungs. Question 24. A client on a potassium infusion, KCL, shows tall peaked T waves on the EKG. What should the nurse do? Increase the infusion rate. Continue the infusion as ordered. Discontinue the potassium infusion immediately. Administer a bolus of 4 fluids. Tall peaked T waves are a classic sign of hyperkalemia. The nurse must stop the potassium source immediately to prevent cardiac arrest. Question 25. Where does rhabdomyosarcoma originate in children? The cerebellum, the kidneys, the leg bones, striated, skeletal, muscles. Rhabdomyosarcoma is a soft tissue sarcoma that originates in striated muscles and can occur anywhere in the body. Question 26. What is a fundamental goal of traditional Chinese medicine? Eliminate all bacteria. Restore the balance of yin and yang. Achieve total physical strength. Focus solely on organ transplant. The foundational principle of traditional Chinese medicine is maintaining or restoring the balance between the complementary forces of yin and yang. Question 27. A client with cardiomyopathy has a drop in BP, increased HR, and dizziness. What is the appropriate advice? Restrict fluids. Increase intake of protein-rich fluids. Increase fluid intake, force fluids. Limit fluids to caffeinated beverages. The symptoms, orthostatic hypotension and tachycardia, indicate volume depletion. Increasing fluids can help stabilize the blood pressure. Question 28. What is the primary purpose of a pulmonary artery, Swan-Ganz, catheter? Measure stroke volume. Measure venous pressure. Assess left ventricular functioning. Monitor heart rate. A Swan-Ganz catheter provides indirect measurements of left ventricular end diastolic pressure, reflecting left-sided heart function. Question 29. A nurse finds a patient in ventricular fibrillation. What is the priority intervention? Start in 4. Initiate high-quality chest compressions. Establish an airway. Obtain the crash cart. Current AHA guidelines, CAB, prioritize chest compressions first in cardiac arrest to maintain perfusion to vital organs. Question 30. A client is taking digoxin and metoprolol. Which finding is of greatest concern? BP 94/60 mm Hg, heart rate 76 bpm, urine output 50 ml/hour, RR 16 bpm. Both digoxin and metoprolol can lower heart rate, and metoprolol lowers blood pressure. A BP of 94/60 is too low for safe administration of these drugs. Question 31. A sweaty, pale male is found wandering and confused. Which test should be done first? CT scan, blood cultures, blood sugar check, arterial blood gases. In a symptomatic patient with potential diabetes, hypoglycemia must be ruled out immediately as it is a rapidly reversible cause of confusion. Question 32. What is the most important factor in determining when to start toilet training a child? The child's age, the parent's schedule, the child's mental and physical readiness, the availability of a potty chair. Toilet training success depends on the child's physiological ability to control sphincters and the cognitive ability to follow instructions. Question 33. A child swallowed cleaning fluid. What is the most important instruction for the parent? Give syrup of ipecac. Take the child to the ER. Contact the poison control center quickly. Make the child drink milk. Poison control provides the most specific and immediate guidance for the exact substance ingested. Question 34. Where is the correct site for a vitamin K injection in a 30-day-old infant? Gluteus maximus, vastus lateralis, deltoid, vastus medialis. The vastus lateralis, thigh, is the preferred site for IM injections in infants due to muscle development and avoidance of nerves. Question 35. A nonverbal 4-year-old has no ID band. How should the nurse identify the child? Ask a coworker. Check the room number. Ask the parent in the room the child's name. Ask the child to write their name. The parent or legal guardian is a reliable source for identifying a minor when an ID band is missing. Question 36. A nurse expects which lab finding in a patient with primary hyperparathyroidism? Elevated serum calcium, low serum parathyroid hormone, elevated serum vitamin D, low urine calcium. Hyperparathyroidism causes excessive calcium to be pulled from the bones into the blood, leading to hypercalcemia. Question 37. Which diet modification is not recommended for a patient with Addison's disease? High protein diet, adequate caloric intake, restricted sodium diet, diet high in grains. Addison's disease involves sodium wasting. These patients require adequate or even increased sodium intake, not restriction. Question 38. A post-op diabetic patient is confused and shaky. What is the most likely cause? Hyperglycemia, hypoglycemia, anesthesia reaction, diabetic ketoacidosis. Confusion and shakiness in a diabetic who has been NPO or has decreased intake postoperatively are classic signs of hypoglycemia. Question 39. Which symptom 18 hours after a colonoscopy is most concerning for bowel perforation? Nausea, increasing abdominal pain and fever, mild bloating, flatulence. Bowel perforation leads to peritonitis, which manifests as severe pain, fever, chills, and abdominal rigidity. Question 40. Which laboratory tests assess coagulation before a liver biopsy? Hemoglobin and hematocrit, point, PTT, and platelet count, BUN and creatinine, white blood cell count. Prothrombin time, point, partial thromboplastin time, PTT, and platelets are essential to ensure the patient can clot after an invasive procedure. Question 41. What is the most likely route of transmission for hepatitis A? Blood transfusion, contaminated food, sexual contact, shared needles. Hepatitis A is transmitted via the fecal-oral route, most commonly through contaminated food or water. Question 42. Which condition prevents a relative from donating blood to a leukemia patient? History of hepatitis C, remission of Crohn's disease, history of cholecystectomy, asymptomatic diverticulosis. Hepatitis C is a blood-borne viral infection and is a permanent contraindication for blood donation. Question 43. Which medication is contraindicated for a patient with acute gastritis? Calcium carbonate, clarithromycin, naproxen sodium, naproxen, furosemide. Naproxen is an NSAID that can irritate the gastric lining and worsen gastritis or cause ulcers. Question 44. What nutritional instruction is important for a patient with cholecystitis? Maintain a high-carb diet, limit fatty foods, increase animal protein, eat only once a day. Cholecystitis is inflammation of the gallbladder. Fats trigger gallbladder contraction and bile release, which causes pain if stones or inflammation are present. Question 45. Which symptom is expected in a patient with severe pulmonary edema? Bradycardia, slow, deep respirations, air hunger, stridor. Pulmonary edema causes fluid to fill the alveoli, resulting in severe dyspnea, gasping for breath, and air hunger. Question 46. Who is the most likely candidate for an automatic internal cardioverter defibrillator, AICD? Patient with controlled atrial tachycardia, patient with a history of ventricular tachycardia and syncope, post-op bypass patient recovering normally, patient with a stable ME. AICDs are indicated for patients at high risk for life-threatening ventricular arrhythmias. Question 47. What is a contraindication for a magnetic resonance imaging (MRI) scan? Allergy to shellfish, claustrophobia, cardiac pacemaker, taking antipsychotics. The powerful magnets in an MRI can interfere with, move, or deactivate a cardiac pacemaker. Question 48. Which symptoms suggest a pulmonary embolism? Sudden chest pain and shortness of breath, fever and chills, wet cough with crackles, somnolence. Sudden onset of dyspnea and pleuritic chest pain are hallmark signs of a pulmonary embolism. Question 49. A patient has a rapidly enlarging abdominal aortic aneurysm. What is the expected action? Discharge with follow-up, observation for 48 hours, schedule resection/surgery, administer sclerotherapy. A rapidly enlarging aneurysm is at high risk for rupture, which is a surgical emergency. Question 50. A leukemia patient has a platelet count of 25,000/microliter. What is the priority nursing action? Monitor for fever, wear a respiratory mask, check for signs of bleeding, increase physical activity. Severe thrombocytopenia, low platelets, puts the patient at high risk for spontaneous bleeding. Question 51. Which finding in a 4-year-old with head trauma is most concerning? Bulging anterior fontanelle, repeated vomiting, sleepiness at 10 p.m., inability to read. Repeated vomiting is a classic sign of increased intracranial pressure in children. Question 52. Which observation indicates a child may have rubella, measles, teardrop on a rose petal lesions, small blue-white spots on oral mucosa, low-grade fever only, rash starting on the trunk? Colic spots, blue-white spots on the buccal mucosa, are pathognomonic for measles. Question 53. Which of the following is not a correct description of scarlet fever? Caused by group A strep. Strawberry tongue is a sign. Petechiae on the soft palate is common. The pharynx is red and swollen. Petechiae on the soft palate are more characteristic of rubella. The other options describe scarlet fever accurately. Question 54. A 30 kilograms child is prescribed 25 milligrams Benadryl 3x/day. The pediatric dose is 5 mg/kg/day. This dose is correct, too low, too high, toxic. 5 milligrams x 30 kilograms equals 150 milligrams per day. The current order is 75 milligrams per day, 25 x 3, which is only half the recommended dose. Question 55. A mother is concerned that her 2-month-old has only one felt testis. What is the most accurate information? Normally testes descend by birth. Surgery is required immediately. Normally testes descend by 1 year of age. The infant is missing a kidney. In many infants, the testes descend later in the first year of life. Surgery is usually delayed until after age 1. Question 56. Which statement describes stage 2 Wilms tumor? Tumor is limited to the kidney. Tumor extended beyond the kidney but was completely resected. Tumor has spread to the lungs. Bilateral renal involvement. Stage 2 involves regional extension beyond the kidney capsule, but the tumor can still be fully removed surgically. Question 57. Which finding is consistent with acute glomerulonephritis? Clear urine, brown, tea-colored urine, low urine-specific gravity, hypotension. Hematuria causes the urine to appear dark or tea-colored in patients with glomerulonephritis. Question 58. What most commonly causes acute glomerulonephritis in children? Congenital defect. Group A streptococcus infection 10 to 14 days prior. Viral infection of the bladder. Nephrotic syndrome. Post-streptococcal glomerulonephritis is an immune-mediated response following a throat or skin infection. Question 59. What is the recommended treatment for a 1-month-old with a hydrocele? Immediate surgery. Massaging the groin. No treatment, it usually reabsorbs. Supine positioning for 24 hours. Most neonatal hydroceles resolve spontaneously within the first few months to a year as the fluid reabsorbs. Question 60. A patient with PVD has burning/tingling in the hands and feet and cannot tolerate touch. Why? Fluid overload. Inadequate tissue perfusion leading to nerve damage. Psychiatric disturbance. Skin inflammation. Chronic ischemia, lack of oxygenated blood, from PVD damages peripheral nerves, causing neuropathy and pain. Question 61. A nursing assistant is caring for a Parkinson's patient. Which action requires intervention? Assisting with ambulation. Reminding patient not to look at feet. Performing complete bath and oral care. Encouraging self-feeding. Parkinson's patients should be encouraged to be as independent as possible. Performing all ADLS for them promotes dependence and muscle atrophy. Question 62. Which statement about chronic low back pain indicates a need for further teaching? I will avoid exercise because the pain gets worse. I will use heat or ice. I will wear flat shoes. I will use a firm mattress. Exercise and core strengthening are essential for managing and preventing chronic back pain. Total avoidance is harmful. Question 63. A patient with a spinal cord injury has a BP of 168/94 and a headache. What is the first action? Administer Tylenol. Check Foley tubing for kinks. Notify the physician. Adjust room temperature. These are signs of autonomic dysreflexia. The first step is to remove the noxious stimulus, which is usually a distended bladder. Question 64. Which patient should be assigned to a new graduate RN on a neurologic unit? Newly admitted spinal cord injury. 67-year-old with a stroke 3 days ago and left-sided weakness. 85-year-old with dementia needing transfer. 54-year-old with Parkinson's needing a bath. The stroke patient is stable and has predictable needs compared to a new PSI or a transfer, making them suitable for a new nurse. Question 65. What is the priority assessment for a spinal cord injury at level C3-4? Check for spinal shock. Assess mobility. Monitor respiratory effort and O2 saturation. Check sensation level. Injuries at C3-C5 affect the phrenic nerve, which controls the diaphragm. Respiratory failure is the primary risk. Question 66. Which action can be delegated to a nursing assistant for a patient with a spinal cord injury? Assess respiratory status. Take and record vital signs. Monitor nutritional status. Teach the patient to deep breathe. Vital signs are within the scope of a nursing assistant. Assessment and teaching require an RN. Question 67. Which strategy helps stimulate a patient with a spinal cord injury to void? Pulling on pubic hair, tapping the bladder, stroking the inner thigh, all of the above. Techniques like tapping the bladder or sensory stimulation can help trigger the detrusor muscle in some PSI patients. Question 68. An LPN can perform which action for a patient with a halo fixation device? Assess neurologic status. Clean insertion sites with hydrogen peroxide. Adjust the tension of the halo. Determine the level of sensation. LPNs can perform site care and monitor for infection, but neurological assessment is the responsibility of the RN. Question 69. A patient with NCI says, "My life's over." Which nursing diagnosis takes priority? Risk for injury, imbalanced nutrition, impaired adjustment to spinal cord injury, poor body image. The patient's statement indicates a failure to cope with the life-altering effects of the injury, requiring psychological intervention. Question 70. Which patient is best assigned to a float nurse new to the neuro unit? Newly diagnosed MS patient, chronic ALS patient, Guillain-Barré patient in distress, C4 spinal cord injury. The ALS patient with a chronic condition is more stable than the others who are in acute distress or need complex new teaching. Question 71. A patient with MS is too tired to take a bath after point. What is the priority diagnosis? Fatigue, activity intolerance, impaired physical mobility, self-care deficit related to fatigue. While fatigue is present, the immediate problem is the inability to perform activities of daily living, bathing, due to that fatigue. Question 72. What should an LPN report immediately for a patient with Guillain-Barré syndrome? Numbness in fingers, facial weakness, heart rate of 102, shallow respirations and decreased breath sounds. Ascending paralysis in GBS can reach the diaphragm, leading to respiratory failure, which is a medical emergency. Question 73. A patient with myasthenia gravis has a fever, high HR, and high BP. What is the first action? Give Tylenol. Notify the physician immediately. Recheck vitals in 1 hour. Reschedule physical therapy. These signs suggest a myasthenic crisis, which can lead to respiratory failure and requires immediate medical intervention. Question 74. Why did a patient with a hemorrhagic stroke not receive alteplase, TPA? They arrived too late. It is only for heart attacks. It dissolves clots and would worsen brain bleeding. They had recent gallbladder surgery. TPA is a clot buster. In a hemorrhagic stroke, the problem is bleeding, not a clot. Giving TPA would cause fatal hemorrhage. Question 75. Which action for a right hemisphere stroke patient requires intervention? Instructing the patient to sit up straight, moving the tray to the right side, passive ROM exercises, combing the left side of the patient's hair. Patients with right brain strokes often have neglect and cannot perceive that they are leaning. Simply telling them to sit up is ineffective. Question 76. Which artery primarily feeds the anterior wall of the heart? Circumflex, internal mammary, left anterior descending, LAD, right coronary artery. The LAD supplies the front, anterior, part of the left ventricle. Question 77. When do the coronary arteries primarily receive blood flow? During inspiration, during diastole, during expiration, during systole. During systole, the contracting heart muscle compresses the arteries. They fill when the muscle relaxes during diastole. Question 78. What is the leading cause of death in the United States? Cancer, coronary artery disease, CAD, liver failure, renal failure. CAD accounts for more deaths than any other single illness in the U.S. Question 79. Which condition most commonly results in coronary artery disease? Atherosclerosis, diabetes mellitus, myocardial infarction, renal failure. Atherosclerosis, plaque buildup, is the primary underlying cause of CAD. Question 80. How does atherosclerosis impede coronary blood flow? Plaques obstruct the vein, plaques obstruct the artery, clots form outside the wall, vessels dilate too much. Atheromatous plaques form inside the arterial walls, narrowing the lumen and restricting blood flow. Question 81. Which risk factor for CAD cannot be corrected? Smoking, diabetes, heredity, hypertension. Genetic makeup, heredity, is a non-modifiable risk factor. Question 82. Serum cholesterol above what level significantly increases CAD risk? 100 mg/dl, 150 mg/dl, 175 mg/dl, 200 mg/dl. A total cholesterol level above 200 mg/dl is considered high and increases the risk of plaque formation. Question 83. What is the first priority for a client exhibiting signs of CAD? Decrease anxiety, enhance myocardial oxygenation, administer nitroglycerin, educate the client. Oxygen is the priority to prevent myocardial ischemia and tissue death. Question 84. Which is a non-invasive medical treatment for CAD? Cardiac catheterization, coronary bypass surgery, oral medication administration, angioplasty. Medication is considered medical/conservative therapy, the others are invasive diagnostic or surgical procedures. Question 85. Occlusion of the right coronary artery primarily affects which area? Anterior, apical, inferior, lateral. The right coronary artery, RCA, supplies the right ventricle and the inferior wall of the left ventricle. Question 86. What is the most common symptom of myocardial infarction? Dyspnea, edema, chest pain, palpitations. Chest pain, often described as pressure or squeezing, is the hallmark symptom of NME. Question 87. What is the correct landmark for the apical pulse? Left intercostal, mid-axillary, left fifth intercostal, mid-clavicular, left second intercostal, mid-clavicular, left seventh intercostal, mid-clavicular. The mitral area, apex, is located at the 5th ICS, MCL. Question 88. Pain described as knife-like and increasing with inspiration is usually cardiac, gastrointestinal, musculoskeletal, pulmonary. Pleuritic chest pain, sharp/knife-like and worse with breathing, is characteristic of pulmonary issues like pleurisy or PE. Question 89. Where is the pulmonic valve auscultated? Second right intercostal space, fifth left intercostal space, second left intercostal space, third right intercostal space. The pulmonic area is at the second left ICS at the sternal border. Question 90. Which blood test is most specific for cardiac muscle damage? Lactate dehydrogenase, complete blood count, Troponin I, creatine kinase, total. Troponin I is highly specific to cardiac tissue and remains elevated for several days after an injury. Question 91. Which action for a stroke patient can be delegated to a nursing assistant? Assist with repositioning every 2 hours. Check extremities for edema. Assess for redness. Evaluate swallow reflex. Turning and positioning are standard tasks for nursing assistants. Question 92. What instruction should be given to a NA feeding a stroke patient? Feed them as fast as possible. Suction between bites. Position the patient sitting upright. Check the gag reflex. Sitting upright, 90 degrees, is essential to prevent aspiration in patients with potential dysphagia. Question 93. A patient has bacterial meningitis and a fever of 102.6. Which action is first? Give oral codeine. Infuse 4-ceftriaxone, antibiotic. Give Tylenol. Give Lasix. Bacterial meningitis is fatal if untreated. Rapid antibiotic administration is the absolute priority. Question 94. Which student action in a meningitis room requires immediate intervention? Entering without a mask or gown. Restricting visits to 10 minutes. Giving the patient a warm blanket. Checking pupils every 30 minutes. Meningococcal meningitis requires droplet precautions, mask/gown, to prevent transmission to staff and others. Question 95. Which task can be delegated to an LPN for a seizure patient? Develop a discharge plan. Administer oral phenytoin, Dilantin. Teach oral hygiene. Document complex postictal behaviors. LPNs can administer routine scheduled medications. Assessment and discharge planning are RN duties. Question 96. What is the priority action when a patient begins having a seizure? Apply an oxygen mask. Administer 4-lorazepam. Turn the patient to the side and protect the airway. Assess level of consciousness. Airway protection and preventing injury are the immediate priorities during the active phase of a seizure. Question 97. Which lab result for a patient on phenytoin, Dilantin, is most concerning? Inflamed gums. WBC count of 2300/mm3. Forgetting a dose. Requesting a driver's license. Dilantin can cause blood dyscrasias like leukopenia, low WBC, which requires stopping the medication. Question 98. Which patient should the nurse assess first at 0700? Migraine patient with nausea. Patient scheduled for surgery in 30 minutes. Parkinson's patient needing swallow assessment. Multiple sclerosis patient with fever and flank pain. The MS patient showing signs of pyelonephritis, fever/flank pain, is the most acute and needs immediate intervention. Question 99. And NA can perform which task for a Parkinson's patient? Select all that apply. Check BP for orthostatic changes. Assist with strengthening exercises. Remind patient to take time eating. All of the above. NAS can take vitals, assist with pre-planned exercises, and reinforce mealtime safety. Question 100. An LPN team leader in LTC is best assigned which task for an Alzheimer's unit? Check for memory improvement after new meds. Perform the mini mental state exam. Assist residents to the toilet. Develop individualized activity plans. LPNs can monitor for expected drug effects and communicate findings to the RN. Question 101. A husband of an Alzheimer's patient is exhausted and anxious. What is the priority diagnosis? Decreased cardiac output, caregiver role strain, ineffective regimen management, risk for falls. The husband's description of lack of sleep and anxiety indicates he is struggling to cope with the demands of caregiving. Question 102. A patient with a glioblastoma on dexamethasone has a new finding, which is most concerning. Blood glucose of 234. Patient does not recognize family. Continued headache. Weight gain of 1 kilogram. Failure to recognize family is a new neurological deficit indicating worsening ICP or brain tumor progression. Question 103. An alcoholic patient with a fall history is lethargic and confused. What is the priority? Alcohol withdrawal protocol. Transfer for a CT scan. Insert a catheter. Give phenytoin. The history suggests a chronic subdural hematoma, which must be diagnosed via imaging and potentially surgically evacuated. Question 104. Which neuro-ICU patient is best for a float nurse from a medical unit? Basilar skull fracture with clear nasal drainage. Ruptured berry aneurysm. Meningitis patient who needs scheduled antibiotics. Craniotomy patient just returned from war. The meningitis patient is the most stable and requires standard nursing skills like 4 antibiotic administration. Question 105. What is the priority nursing diagnosis for a migraine headache? Acute pain, anxiety, hopelessness, risk for side effects. Migraines are characterized by intense, debilitating pain, which must be the primary focus of care. Question 106. What is the normal drainage 4 days after a sigmoid colostomy? Green liquid, solid formed, loose, bloody, semi-formed. Immediate post-op drainage is usually loose and may contain some blood. Formed stool doesn't typically appear for a week. Question 107. Where should the call light be placed for a patient with left homonymous hemianopsia? On the left side, in front of the client, on the right side, wherever the client wants. In left homonymous hemianopsia, the patient is blind in the left visual field of both eyes. The light must be on the right side to be seen. Question 108. What are the first nursing actions for an accident victim? Check neuro response. Check pupils and hemorrhage. Check airway, stabilize spine, check circulation. Assess lock. ABC management, airway/spine stabilization, breathing, circulation, is the standard trauma protocol. Question 109. How does nitroglycerin relieve angina? Increases contractility, increases heart rate, decreases oxygen consumption, decreases venous return through vasodilation. Dilating the veins, venodilation, reduces the preload, venous return, which decreases the heart's workload. Question 110. A post-me patient is unresponsive to shaking. What is the next action? Clear the airway, call for help and note the time. Precordial thump. Administer rescue breaths. The first step in an unresponsive patient is to activate the emergency response system. Question 111. A nurse caring for a GI bleed patient should prioritize planning for 8 hours of sleep, monitoring vitals every 2 hours, giving food/meds at prescribed intervals, providing milk every 2 hours. Regularly scheduled food and meds neutralize gastric acid and protect the GI lining from further bleeding. Question 112. A patient on heparin has a PTT of 68 seconds, normal 30 to 45. What should the nurse do? Stop the heparin. Continued treatment is ordered. Increase the dose. Notify the physician to stop. A therapeutic PTT for heparin is typically 1.5 to 2 times the normal value, approximate 45 to 90 seconds. 68 is therapeutic. Question 113. When should an ileostomy appliance be applied? 24 hours later. In the operating room. After it starts to function. When the client can do it. Ileostomy drainage contains caustic enzymes. The skin must be protected with an appliance immediately during surgery. Question 114. How should a client be positioned after spinal anesthesia? Side lying, flat on back, knees flexed, on the stomach. Staying supine for 4 to 12 hours prevents the leakage of CSF and the development of a spinal headache. Question 115. Which finding suggests increasing intracranial pressure? BP decrease from 160 to 110. Pulse increase from 87 to 95. Patient is oriented when aroused but falls back asleep. Anorexia. A decreasing level of consciousness, extreme somnolence, is an early sign of rising ICP. Question 116. Which pneumonia symptom appears first in the elderly? Fever and chills, hemoptysis, altered mental status and dehydration, pleuritic chest pain. The elderly often present with atypical signs like confusion or lethargy rather than a high fever. Question 117. Which are typical symptoms of active tuberculosis, TB? Lower back pain, chills, fever, night sweats, and hemoptysis, high fever and nausea, photophobia. TB is characterized by constitutional symptoms like night sweats and weight loss, and respiratory symptoms like hemoptysis. Question 118. A 7-year-old is tachypneic with a non-productive cough after a cold. What is likely? Acute asthma, bronchial pneumonia, COPD, emphysema. Asthma is often triggered by viral infections in children, presenting as tachypnea and a dry cough. Question 119. A patient's RR is 4 after receiving morphine. What is the immediate risk? Asthma attack, respiratory arrest, seizure, wake up on her own. Morphine is a CNS depressant. A rate of 4 indicates imminent respiratory failure. Question 120. Which is a normal physiologic change of the lungs in aging? Increased elastic recoil, increased functional capillaries, decreased residual volume, decreased vital capacity. Aging naturally reduces the elasticity of lung tissue and the strength of respiratory muscles, decreasing vital capacity. Question 121. Which arthritis is characterized by urate deposits and occurs mainly in men over 30? Septic arthritis, traumatic arthritis, intermittent arthritis, gouty arthritis. Gout is a metabolic disorder where uric acid crystals deposit in joints, causing severe inflammation. Question 122. Heparin 1,500 units/hour is ordered. The bag has 25,000 units in 500 milliliters. How many ml/hr? 15 milliliters per hour, 30 milliliters per hour, 45 milliliters per hour, 50 milliliters per hour. 1,500 units/25,000 units, asterisk 500 milliliters equals 30 milliliters per hour. Question 123. Why might a stroke patient's arm swell? Contractures, loss of muscle contraction decreasing venous return, hypoalbuminemia, ipsilateral DVT. Muscle movement helps pump blood back to the heart. Paralysis leads to venous stasis and edema. Question 124. Where do Heberden's nodes appear in osteoarthritis? Proximal interphalangeal joint, distal interphalangeal joint, metacarpophalangeal joint, wrist joint. Heberden's nodes are bony growths at the distal, fingertip, joints. Question 125. What is the main difference between rheumatoid, RA, and osteoarthritis, OA? OA is systemic, RA is localized. OA is localized, RA is systemic. OA is gender-specific. OA has subluxations, RA doesn't. OA is a wear and tear disease of specific joints. RA is an autoimmune disease affecting the whole body. Question 126. How should a cane be used? On the affected side, On the unaffected side. With both hands. Only when walking backwards. Holding the cane on the stronger side provides better balance and takes weight off the weaker side. Question 127. A 70/30ths insulin dose is 30 U. How much of each insulin is this? 9 U regular and 21 U NPH, 21 U regular and 9 U NPH, 10 U regular and 20 U NPH, 15 U regular and 15 U NPH. 70/30ths means 70% NPH and 30% regular. 30% of 30 is 9, 70% of 30 is 21. Question 128. Which medication is specific for treating gout? Aspirin, Lasix, colchicine, calcium gluconate. Colchicine is used to reduce inflammation specifically caused by uric acid crystals in gout. Question 129. Primary hyperaldosteronism affects which gland? Adrenal cortex, pancreas, adrenal medulla, parathyroid. Aldosterone is a mineralocorticoid produced by the outer layer, cortex, of the adrenal gland. Question 130. Why are wet-to-dry dressings used for a diabetic foot ulcer? Provide moisture, debride the wound, prevent microorganisms, minimize discomfort. Wet-to-dry dressings are a form of mechanical debridement used to clear necrotic tissue. Question 131. Which lab finding is expected in an Addisonian crisis? Hyperkalemia, reduced BUN, hypernatremia, hyperglycemia. Addison's involves low aldosterone, which causes the body to retain potassium, hyperkalemia, and lose sodium. Question 132. What is an appropriate intervention for SIAD? Rapid 4 fluids, encouraging oral intake, restricting fluids, giving glucose fluids. SIAD causes excessive water retention. Restricting fluid intake is necessary to correct the water imbalance. Question 133. Which test determines blood glucose control over the past 3 months? Urine glucose, fasting blood glucose, serum fructosamine, glycosylated hemoglobin, HbA1c. HbA1c measures the percentage of hemoglobin with attached glucose, reflecting a 90 to 120 day average. Question 134. When is a patient most at risk for hypoglycemia after 7 a.m. NPH insulin? 10 a.m., noon, 4 p.m., 10 p.m. NPH is intermediate acting and typically peaks 8 to 12 hours after administration, approximate 3 to 7 p.m. Question 135. The adrenal cortex produces which of the following? Glucocorticoids and androgens, catecholamines and epinephrine, mineralocorticoids and catecholamines, norepinephrine. The cortex produces steroid hormones, the medulla produces catecholamines, epinephrine/norepinephrine. Question 136. Which electrolyte disturbance commonly follows thyroid surgery? Hyponatremia, hyperkalemia, hypocalcemia, hypermagnesemia. Accidental removal of the parathyroid glands during thyroidectomy leads to a drop in serum calcium. Question 137. Which lab value is elevated in smokers and not a specific cancer indicator? Acid phosphatase, serum calcitonin, alkaline phosphatase, carcinoembryonic antigen, SEA. SEA levels are often high in smokers regardless of cancer, making it a poor screening tool for them. Question 138. Which findings are characteristic of iron deficiency anemia? Weight loss and diarrhea, dyspnea, tachycardia, and pallor, nausea and vomiting, jaundice. Reduced hemoglobin leads to poor oxygenation, dyspnea/pallor, and a compensatory fast heart rate. Question 139. What teaching is needed for an HIV-positive pregnant woman? Baby can't get it from the placenta. Birth control is not needed. C-section is always mandatory. HIV can be transmitted transplacentally. The virus can be passed from mother to child in utero, during birth, or through breastfeeding. Question 140. Which discharge instruction is essential for an AIDS patient? Use disposable gloves for bathing. Sterilize plates in boiling water. Avoid sharing toothbrushes and razors. Don't share serving dishes. HIV is most concentrated in blood. Sharing items that might have blood contact is a high risk. Question 141. Which set of findings is characteristic of pernicious anemia? Pallor and bradycardia. Pallor, tachycardia, and a sore tongue. Weight gain. Double vision. Pernicious anemia, B12 deficiency, causes neurological and GI symptoms, including a beefy red sore tongue. Question 142. A client has anaphylactic shock after penicillin. What is the first action? Intubate immediately. Administer epinephrine. Give penicillin antidote. Insert a catheter. Epinephrine is the first-line treatment to reverse bronchospasm and hypotension in anaphylaxis. Question 143. What is a common adverse effect of prolonged high-dose aspirin therapy? Weight gain, tremors, acidosis, bilateral hearing loss. Ototoxicity, tinnitus or hearing loss, is a classic sign of salicylate, aspirin, toxicity. Question 144. Which cell provides adaptive immunity by recognizing foreign antigens? Neutrophil, basophil, monocyte, lymphocyte. B and T lymphocytes are the core of the adaptive immune system and create memory of antigens. Question 145. Nursing care for Sjogren's syndrome focuses on electrolyte balance, moisture replacement, nutrition, arrhythmia management. Sjogren's causes dry eyes, mouth, and skin. Replacing this moisture is the primary goal. Question 146. Which test identifies the horse barn smelling diarrhea in chemo patients? ELISA, electrolyte panel, stool for C. difficile, abdominal X-ray. Clostridium difficile, C. diff, infections are common in immunosuppressed patients and have a distinct odor. Question 147. Which tests are used together to confirm HIV infection? ELISA and Western blot, Erosette, T lymphocyte count, hemogram. A positive ELISA must be confirmed by the more specific Western blot test. Question 148. Why is a CBC performed before surgery? Check liver function. Check urine constituents. Identify low HCT and HB. Check electrolytes. Knowing if a patient is anemic, low HCT/HB, is vital in case of surgical blood loss. Question 149. Which tests monitor for disseminated intravascular coagulation, DIC, platelet count, point, and PTT, blood glucose, WBC count, potassium levels? DIC involves the rapid consumption of clotting factors and platelets, which these tests measure. Question 150. Which of the following is a common food allergen? Bread, carrots, orange, strawberries. Berries, shellfish, and nuts are among the most common triggers for food allergies. Question 151. What is the mean arterial pressure, MAP, for a BP of 126/80? 46 mm Hg, 80 mm Hg, 95 mm Hg, 90 mm Hg. MAP equals systolic plus 2, diastolic /3. 126 plus 160, 3 equals 95.3. Question 152. A client has chest pain and black tarry stools. Which order is anticipated? Cardiac monitor and Lasix. Point/PTT only. EKG, CBC, and occult blood test. EEG and liver enzymes. The EKG checks the chest pain. The CBC and occult blood test check for anemia from GI bleeding. Question 153. A drop in platelets from 230K to 5K after CABG suggests what? Pancytopenia. ITP. DIC. Heparin-associated thrombocytopenia, HAT. HAT, or HIT, is a serious immune reaction to heparin, which is used during bypass surgery. Question 154. Which drug improves platelet counts in IDP? Aspirin, corticosteroids, methotrexate, vitamin K. Steroids reduce the immune system's destruction of platelets in IDP. Question 155. Replacing a human heart valve with a porcine, pig, valve is what type of transplant? Allogeneic, autologous, syngeneic, xenogeneic. Xenogeneic refers to a transplant between different species. Question 156. Which action initiates the extrinsic clotting pathway after an injury? Release of calcium, release of tissue thromboplastin, conversion of 12 to XIIA, conversion of 8 to VIIIA. The extrinsic pathway is triggered by tissue factor or thromboplastin released from damaged cells. Question 157. Lupus, SLE, is often linked to which blood dyscrasia? Dressler's syndrome, polycythemia, essential thrombocytopenia, von Willebrand's. Autoimmune disorders like SLE can cause the body to destroy its own platelets. Question 158. What is an early indication of stage 1 Hodgkin's disease? Pericarditis, night sweats, splenomegaly, hypothermia. Constitutional B symptoms like night sweats and fever are common early signs of Hodgkin's. Question 159. Which function must be assessed frequently in a leukemia patient with neutropenia? Blood pressure, bowel sounds, heart sounds, breath sounds. Neutropenic patients are at extremely high risk for fatal pneumonia. Lung assessment is critical. Question 160. Neurologic complications of multiple myeloma usually involve brain invasion, muscle spasm/spinal cord compression, myocardial irritability, renal failure. Bone breakdown in the spine can lead to tumors compressing the spinal cord, causing spasms or paralysis. Question 161. What is the average time from HIV infection to the development of AIDS? Less than 5 years, 5 to 7 years, 10 years, 20 years. The median time for HIV to progress to AIDS without treatment is approximately 10 to 12 years. Question 162. Which lab finding is consistent with DIC? Low platelet count, elevated fibrinogen, low fibrin degradation products, reduced point. In DIC, platelets are consumed to form microclots, leading to a low count and increased bleeding risk. Question 163. An enlarged supraclavicular node, night sweats, and weight loss suggest influenza, sickle cell anemia, leukemia, Hodgkin's disease. A single painless, enlarged node in the neck/shoulder area is a classic presentation of Hodgkin's. Question 164. A patient is AB negative. Which blood type is safest in an emergency? AB Rh positive, ARH positive, ARH negative, ORH positive. An Rh negative patient must receive Rh negative blood to avoid a hemolytic reaction. Question 165. When should a mother contact the doctor regarding her child on chemotherapy? Difficulty sleeping, persistent vomiting and diarrhea, irritability, hair loss. Vomiting and diarrhea for more than 24 hours can lead to severe dehydration and indicate drug toxicity. Question 166. What is the best response to a mother upset about her child's hair loss from chemo? She looks nice in a hat. Don't worry, she's alive. Hide your feelings. It is temporary, hair grows back in 3 to 6 months. Providing factual, hopeful information about the temporary nature of alopecia helps parents cope. Question 167. How should the nurse promote comfort for a patient with stomatitis? Frequent mouthwash with saline. Apply viscous lidocaine to ulcers. Use lemon glycerin swabs. Rinse with hydrogen peroxide. Topical anesthetics like lidocaine provide immediate pain relief for oral ulcers. Question 168. The foresight for chemotherapy is red and swollen, and the patient is in pain. What is the first action? Notify the physician. Flush the line. Immediately discontinue the infusion. Apply an ice pack. These are signs of extravasation. The infusion must be stopped immediately to prevent tissue necrosis. Question 169. The term blue bloater refers to ARDS, asthma, chronic obstructive bronchitis, emphysema. Bronchitis patients often have cyanosis, blue, and edema/weight gain, bloater. Question 170. The term pink puffer refers to ARDS, asthma, chronic obstructive bronchitis, emphysema. Emphysema patients often have a pink complexion and use pursed lip breathing, puffer. Question 171. In respiratory arrest from a narcotic, the PaCO2 is likely to be 15 mm Hg, 30 mm Hg, 40 mm Hg, 80 mm Hg. Failure to breathe leads to a rapid buildup of carbon dioxide, hypercapnia. Question 172. ABGs, pH 7.16, PaCO 280, PaO 246, HCO 324. What is the condition? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. The low pH, 7.35, and high CO2, greater than 45, indicate an acid-base imbalance caused by the lungs. Question 173. Chest tightness and sob 30 minutes after a new BP medication indicates asthma, pulmonary embolism, respiratory failure/anaphylaxis, rheumatoid arthritis. A rapid reaction to a new drug suggesting airway compromise is an emergency leading to respiratory failure. Question 174. Which lab test confirms liver cirrhosis? Decreased RBC, low acid phosphatase, high WBC, elevated serum aminotransferase, ALT/AST. Liver cell damage causes the release of these enzymes into the blood. Question 175. Why is a cirrhosis patient at high risk for bleeding? Impaired clotting mechanism, varix formation, inadequate nutrition, trauma. The liver cannot produce clotting factors or absorb vitamin K properly when it is cirrhotic. Question 176. What is a common clinical manifestation of hepatic encephalopathy? Increased urine, altered level of consciousness, decreased reflex, hypotension. Ammonia buildup in the blood crosses the blood-brain barrier, causing confusion and altered lock. Question 177. Lactulose is causing diarrhea in a patient with encephalopathy. What should the nurse do? Call the doctor. Withhold the dose. Lower the dose to achieve 2 to 4 stools a day. Explain it reduces sodium. The goal of lactulose is 2 to 4 soft stools per day to clear ammonia. More than that indicates a need for a lower dose. Question 178. Which symptoms indicate a ruptured abdominal aortic aneurysm? High BP, severe lower back pain, and decreased BP, intermittent pain, decreased WBC count. A rupture causes massive internal bleeding, leading to sudden severe pain and hypovolemic shock, low BP. Question 179. A nurse sees a puddle of blood under a patient after a cardiac cath. What is the first action? Call for help, get vitals, ask client to lift up, apply gloves and assess the site. Standard precautions: gloves must be used first, followed immediately by assessment to find the source of bleeding. Question 180. What is a suitable surgical intervention for unstable angina? Cardiac catheterization, echocardiogram, nitroglycerin, angioplasty, PTCA. PTCA is an invasive procedure used to physically open a blocked artery and restore flow.